polled my incredible audience for questions because I told them that I had a vaginal and pelvic floor health expert coming into the show. And so my audience is always very good with the questions. Very smart. I have a very smart audience.
I don't doubt it.
Yeah.
Your podcast is called The Genius Life. It's exactly who I would think would be attracted to it.
Yes, indeed. Geniuses of all sorts, from all walks. So let's go through some of the questions.
It's like rapid fire. Shoot.
It is, yeah. Well, Nutri Habita asked about the vaginal microbiome. We didn't really touch on the microbiome.
Okay. Love the microbiome. So
Yeah.
inside of the vagina, there's a certain amount of bacteria that you have and certain types of bacteria that you have that help ward off infection. And if we change that microbiome, which can happen with things that we eat and drink, it can change with sex, but it often changes with products that we use. And so even if you have an infection and you take antibiotics, that can change the microbiome of the area. But if you're using a lot of these really harsh washes or scented washes, that's going to change the microbiome and actually increase your risk of infection. So I talk about this in the book as well because, you know, we have a gut microbiome. We talk about that a lot, but your vagina has a microbiome as well. And you want to really help maintain that pH balance, which is why it's important kind of what you use in the area and really minimizing the use of chemicals and scents and deodorants and things like that.
What are the most microbiome safe lubricants to use?
I prefer something water-based. So because water absorbs into the tissue and it doesn't linger like silicone or even oil, you could honestly use good old coconut oil, but I'm like, get a new jar, right? I do love a water-based lubricant that just dissolves into the tissues. And there are some that that are organic or aloe-based that are also I'm a big fan of. But ultimately, it's something that feels comfortable to you, but doesn't leave any irritation afterwards.
I love that. Brandy Guillon asked about laser tightening, good or bad? I don't know what that is. What is laser tightening?
So there's a couple different kinds, but there is a laser that you can insert into the vagina with a wand. There's a red light therapy now that's out, and there's also laser that you can do to help tighten the vaginal tissues. It can be short-term effective. The studies don't really follow it up after the 3 to 6 month mark to say how long do those benefits last. Usually you get 3 to 6 treatments. It's several thousands of dollars, but to maintain the benefits of that, you have to be doing regular exercise and taking care of your vulva, vagina, and pelvic floor. Because even if your tissues get stronger and healthier, that's going to go away, again, if you don't get to the root cause of what caused the weakness in the first place.
Yeah, I would think that artificially inducing tightness would be not a good thing.
If you have weakness, then tightening the connective tissue and the collagen can be helpful. But again, this is like not everyone has weakness, right? A lot of people have tension and they probably need to address the tension before they get something to tighten their vaginas. But it is helpful for some women for incontinence or increased sexual satisfaction. But again, it's not the silver bullet that's going to take care of everything. It can be a small piece of the puzzle.
Does collagen from the standpoint of supplementation, does that play any role in vaginal or pelvic floor health?
It's a great question, and there hasn't been any research on it. You know, unfortunately, there are not a lot of pelvic health research studies, and there's been no research on the direct link of collagen to your pelvic floor health. But I will say collagen levels throughout our body decrease with aging, and after menopause, we lose 2% of our collagen every single year. So the way that we see it in our face, the way we see it in our skin, the same thing's happening with your pelvic floor.
Would you say that it's likely safe to assume that the same dietary strategies that support skeletal muscle and metabolic health, yada, yada, also support pelvic floor health, vaginal health, sexual health?
Yeah, I think so. I mean, these are muscles like any other muscles in your body, but I think it also goes with how are we using these muscles, right? How are we relaxing them and contracting them and engaging them, and how are we breathing and sitting and standing? So it sounds like a lot, but it's really just such small lifestyle changes that we can make that really have a big impact.
Are you a fan of red light? Red light
I
therapy?
am a fan of red light therapy, but in certain indications. So this is actually an area I'd like to see a study, but it hasn't been done yet, on using red light therapy for postpartum healing. Because 93% of women get a vaginal or perineal tear during childbirth, but yet there's no follow-up care for them. And scar tissue does not contract and relax the same way that pre-tear tissue does. So they have decreased strength. They have less movement of that tissue, which can lead to painful intercourse. It can lead to urinary leakage. tension in the area. So I am a fan of red light therapy. I just, being a data nerd, want a little bit more research on what the benefits are and how it can be used. There was a study using a wand internally that can be to help rejuvenate the vulvar and vaginal tissues that did show benefits up to 6 months. But again, there were no long-term studies after that to see if it was still effective.
I mean, men are putting it on their balls and for testosterone. There's apparently like an animal study that shows that it boosts testosterone.
Yeah. You know, the thing about all of these is that they're quick fixes. Like, we're still looking for this magic light or wand or chair or laser that's going to cure all of our problems. I think it can help boost and improve some of them. But to me, it's always take it down to the basics of like movement, exercise, nutrition, diet, breathing, stress. I mean, we can do all of those things, but if we don't have those baseline foundational concepts in place, I just feel like we're swimming upstream.
Yeah, I would agree with that. Krusty Krab asks, how do I know if actually we already covered this question. How do I know if I need to see a pelvic floor PT? But I guess a good follow-up question from the Rabbit Hole Creations, they asked how to pick a good pelvic floor therapist. Yeah, so how is one to pick a good pelvic floor therapist, and what are the questions to ask when auditing one?
So I think the first challenge is finding one. So I would talk to your community. I would talk to a medical provider. If you have a gynecologist or urologist, I'd do a quick Google search. And there's also a handful of provider directories online. Like if you go to pelvicrehab.com, that's a directory of PTs, pelvic PTs, specialties. The thing I would look for is go to their websites and make sure they look legit, right? I mean, you want to have somebody who is doing internal pelvic floor therapy as well. To assess the pelvic floor muscles, you need to do an internal vaginal exam or an internal anal exam. That's really the way that you assess them. You can treat pelvic health issues externally, but you don't really know what's going on with the muscles unless you do the internal exam. So if you have tailbone pain and somebody's just telling you to do a bunch of bridges and a stretch, they don't even know if your pelvic floor muscles are involved or helping coach you on that. So they really need to do an internal assessment. The other thing is that they need to not just be using devices. So if they're just putting you on a stimulation unit or a biofeedback unit or a red light therapy, it needs to be a combination of manual exercise, or manual therapy, exercise, lifestyle changes, kind of all these things. And then the last thing is that you have to feel comfortable with them. I mean, this person's going to have probably a finger in your vagina or anus. You're going to be telling them the intimate details of your life, and you want to feel like you can really feel comfortable and trust that person. They also need to be good listeners. I think when patients come in, I get 90% of their story and what I think could be going on just by listening and asking the right questions. And then my exam just confirms it or disconfirms it. But I think they have to be listening. They have to be assessing internally. They have to be giving you a comprehensive exam, and then also help you feel comfortable and kind of part of the team as part of the therapy.
I didn't realize that part of how the sausage is made is with a digital exam. Like you actually have to you have to actually get in there.
Yeah, that's how we assess the muscles.
Wow.
Yeah, it's a good thing I have small fingers.
For real.
And that's the thing. I think that people don't realize, like, this is how you assess the muscles. And it feels weird, I think, at first. It feels a little bit intimidating for people to come in. But to me, I mean, I've been in this practice for 18 years. I've worked with tens of thousands of vulvas and vaginas and pelvic floors, and it's like working with a foot. It's not a big deal at all. It's like you go to a gynecologist or you go to a urologist. It's just a part of the body. And I think if we can really help disarm people and educate them on it, they just start to realize, like, oh, this is just another body part and it deserves care as well. This is just how you care for it.
Should your physical therapist be the same gender as you? I would assume yes.
Doesn't have to be.
Doesn't have
to be. So, like,
be.
I see all genders. I see male patients, female patients, transgender patients. There are also male pelvic floor therapists who see males and females and transgender. So I really think, again, it's one of those things where you feel most comfortable with. I will say there are more male pelvic health therapists coming up, and I think a lot of males prefer to see them. And I'll also say, like, I was seeing patients for 10 years before I became a mom, but going through pregnancy and birth absolutely shifted the way that I care for people during pregnancy and postpartum. So I feel like that helped me because there are similarities, better empathize and care for those patients. So you don't have to be in the same stage of life or gender, but there is a little bit more empathy I think you can have when you are more similar than different.
Yeah. Did you always treat pelvic floor dysfunction?
Always. You know, I got out of physical therapy school. I went to PT school at WashU in St. Louis. And I initially thought I was going to become a trainer for the New Orleans Saints, which was my hometown football team. And we had a 2-week stint on pelvic floor therapy by a professor. And I was like, this is really interesting. Nobody has ever taught me about this. And as a woman, I find it really fascinating to learn about my body in this way. And then during my first clinical rotation, which was about 4 months in Ann Arbor, I was like, this is amazing. I mean, this is life-changing work to help people with an issue they didn't even know there was help for, and yet it's so impactful in their life. And I was like, this is the type of therapy I want to do. And I've always done it.
Hey, if you like that video, you need to check out this one here, and I'll see you there.